Professor Robson, welcome to the programme.
It's a pleasure.
The Health Minister has taken these allegations against Medicare and the misuse of Medicare seriously enough to direct his own department to examine Dr. Faux's work and also to look at their own compliance systems. Given the pressure on the health budget, do you welcome that review?
We welcome any further work that's going to try and illuminate the issue here, and we think it's great if there's going to be further investigation.
In fact, there's been a series of work done over a number of decades. An earlier PhD came to strikingly similar conclusions. The former Medicare regulator, Tony Webber, also raised the alarm about misuse of Medicare. What has the AMA done in the intervening years to improve that misuse of the system?
I think we all want to be very, very good stewards of the health budget, and after everything we've seen through the pandemic, that's become more important. So we've worked extensively with the health department. I've been part of the structures and reviews in place to try and modernise Medicare, to take a lot of the complexity and confusion out of things and make sure that we get rid of things like low-value care. We've just had a review that hundreds and hundreds of doctors and clinicians have been involved in to totally revamp the medical benefit schedule, and we think that's a great thing.
So what is your view now about the level of Medicare misuse in the system?
Well, if you look at the health budget and the state and territory health budgets, they're enormous line items, and I think that any huge expenditure like that is going to have waste, and in a very small proportion of cases there's going to be misuse. So if there's misuse, we want to throw the book at the individuals, and all of the cases that we've seen are actually successes because they were picked up by the Professional Services Review or other bodies. So they're success stories that they were detected, and if there is some way that we can deal with waste or low value care, we're all for it.
Now, you just said a small number. What is that number in your view?
Well, if we look statistically, something like 1 in 1,000 doctors taken to the Professional Services Review. I guess that must be a reasonable reflection of things.
I don't think it's my question, though. Let's just come back to the question. You used the word small. I'm just asking, we've got a report this week that the wastage within Medicare could be up to 30% or up to $8 billion. You say the figure is in fact small. What is that figure, that small figure?
So I said the number of doctors involved in misuse was small. That was what I was saying. I think if we look at potential waste, other things in Medicare, if you look at the data from the National Audit Office a couple of years ago, they found it was difficult to tell, but their range started at $300 million, which is a huge amount of money. But it reflects the fact that there's a lot of complexity in the system, and we want to see that fixed up, Sarah. I'm
trying to get an understanding of where the AMA is at the moment in relation to misuse across the Medicare system. But just to go to the Auditor General's report, the one that you just cited, in fact, the Auditor General's report had a range in its number from 366 million, which is the figure you quoted at the lowest end, up to 2.2 billion. Clearly, the department itself has struggled to get a handle on this. What makes you so confident that the higher range figure that Dr. Faux quotes, therefore, is incorrect?
I think we've seen all of the people who are close to the data have found it extremely perplexing, that big figure. And I think, as I said to you before, that range that began around 300 million, it's a lot of money, and we're very keen to see it investigated. So if there's an actual up-to-date investigation that's not something from the past, we're all for it and we want to be part of it.
What do you mean by something from the past?
Well, I think that there were no actual data, as we could see in the PhD. There was a lot of conjecture, and it's important to look at opinion there. But we really want to see up-to-date data. There's been a huge change in the medical benefit schedule with the MBS review. So a lot of the what we call item numbers, a lot of the rebates have changed very significantly over the last few years. And we've had the pandemic cause huge disruption with the move, for example, to telehealth. So there's been a massive change in the landscape. And I think if we're going to talk about it, we're all for it, but you've just got to use data that reflect current practice after the MBS has been changed.
So do you think that it would be a good idea then for you to sit down with Dr. Faux and others who've raised issues about misuse, examine their evidence and their methodology to work out the precise scale of the problem?
Yeah, well, look, I've got 2 PhDs myself, so I'm fairly familiar with PhD analysis, and I'd love to sit down if that invitation came, if we all had time.
Have you read Dr. Faux's PhD?
I've got a copy. I haven't read the whole thing. It's like my PhD. It's very, very long. But if there was some reason to read it, I think I'd actually rather focus on some solutions and moving forward rather than reading someone else's PhD.
Just to go back to the Auditor General's report, because included in that report was an acknowledgement by the Auditor General that the Department of Health's approach to monitoring false or improper claims were insufficient and needed reforming. Doesn't that tell you that the critics of the current system have a point?
Like I said to you before, Sarah, we're all for any further investigations, and I think it's really important in this current environment that we deal with things like waste in the system or low-value care. Now, we note that the AMA was intimately involved in the MBS review, and that's changed a lot of things. It's meant to deal with a lot of these issues. And as I said to you just before, there's been such a huge change with the pandemic and in the aftermath of the MBS review and the way so many things were changed. We'd love to look at data. I'd love to look at data, but it just needs to be contemporaneous. And I think we need to deal with the situation as it stands moving forward. And I agree with you, it's important. I
just want to go to the former Deputy Chief Medical Officer, Professor Nick Coatsworth. He says that the AMA, and I think he's talking about you in particular, is protesting too much because he says, quote, there's a leakage of public funds to the tune of billions of dollars due to a combination of waste, over-servicing and fraud. This is a very senior member of your own profession. What do you say to him?
I say that we're really keen. I personally am really keen to deal with these issues, but we've got to get the data right. And I think the $8 billion figure's been completely debunked by anybody close to the data. No, I'm not saying it's insignificant for a second. I'm saying we don't actually know at the moment. I'd love to get to the bottom of it. I think it's really important we do. We want to be good stewards of the health budget.
How many doctors have lost their Medicare billing privileges after misusing the system?
I've got no idea.
Isn't that a number that you should know?
Why?
Well, you've
I
called...
think, I'm the president of the AMA. I'm not a...
You've called the data in Dr. Faux's PhD, you say it's been debunked, but I'm asking you a simple question about the numbers of doctors who've had their privileges withdrawn after misuse, and you don't know the answer to that question. Even an approximate figure?
I've got no idea. I'm saying that the $8 billion figure has been debunked. I think you could go to the regulator, you could go to the Professional Services Review and actually get an accurate answer to that.
Do you think that doctors who misuse the system should face criminal prosecution?
I think you should throw the book at doctors who misuse the system, and I hope that happens. I hope our compliance activities pick them up and that they're dealt with appropriately. It's an important issue. I agree with you, Sarah.
So I just want to question you just briefly on that misleading and use of the word debunked. Who are the people who've looked at the thesis and debunked it? You tell me who they are.
Look, I'm happy to go through lots of people. We've heard from, for example, the Health Minister that the figures didn't really make sense to him.
But he also said that he also said they were concerning enough to ask the department to conduct a review. So that's not a debunking.
I've just said they're concerning as well, Sarah.
I think I'm asking you who's debunked it.
I'm happy to go back and have a look, but they don't come to mind, but I've seen lots of people.
Well, we'll leave it there. Professor Robson, thank you very much indeed for joining us.
It's been a pleasure.